Greetings and welcome to the ESP Professional Development webinar. Thank you for joining us today. It's my pleasure to welcome you to ESP's Professional Development webinar series. My name is Paul Roback, and I am currently serving as chair of ESP's Professional Development Committee. At the national conference a couple of weeks ago, I was elected onto the board, and it just happens that one of our presenters was elected onto the board at that same meeting as well, Jenna Daniel, and she'll introduce herself in just a moment. We're happy to see so many people here with us today. The webinar is being recorded, as you heard just a moment ago, and it will be posted on the ESP website after the session, and we'll email that link out to you. Please take a moment, if you've done so already, to drop your name and institution in the chat box so we can just capture who's with us today. Please keep in mind that all ESP members are welcome to submit webinar proposals. Right after the first of the year, we'll release that RFP out so that you can submit, and the deadline for that will be February 15th. So it's a fairly quick turnaround. So I'd like to give you a heads up now to start thinking about webinar topics that you would like to present in our upcoming series. It's also that time of year where I also want to remind you to renew your ESP membership. Right? So if you're not a member, we encourage you to consider joining so that you continue to access ESP webinars and additional professional development opportunities. All the participants are on mute during the presentation. However, you may use the chat box to ask questions or make statements during the webinar. There'll be a few moments at the end and also throughout to take questions and answers. So with that today, I'd like to introduce you to today's presenters and topics. The topic today is Community Health Coalitions, Extension as an Integrated System for Health and Wellness. And with that, I'll turn it over to Jenna Daniel.
Yeah, well, thank you, Paul, and thank you to everybody who is here this afternoon. We're so excited to share a little bit of time with you. I want to bring up our slideshow really quick. Doesn't matter how long you've been on Zoom. Sometimes it just takes a minute. Let's see if it'll show into. There it goes. Okay, perfect. Well, thank you all again for being here. And as Paul mentioned, my name is Jenna Daniel, and I am so excited to be here this afternoon with a team from Georgia, the Alpha Beta chapter. And like Paul mentioned, we're going to talk a little bit about a project that we have had over the past 5 years in Georgia, and that is working in community health. And so we'll talk a little bit today about how this got started, the funding source that we've been using, and as we look into the future, what that looks like. But first and foremost, just to give you a little bit of a roadmap of our time today, as Paul mentioned, feel free to use the chat, enter any questions or comments you have, and then feel free to pipe in at any point. We'll have time for questions at the end, but we want to make sure that this is a conversation and it's helpful to you as participants. But really, like I mentioned, we'll talk a little bit about the big picture of community health coalitions and how we've integrated and facilitated that process in Georgia. We'll share with you some lessons learned, and these are from our experts, the individuals that are on the ground in the counties and communities supporting these health initiatives and this policy systems and environment change throughout the state. Funding has decreased or ceased, what that looks like as far as sustainability, how we continue to integrate this into our extension system as a state, and then we'll have time for questions. So we are so glad you all are here. And I just first and foremost want to introduce and allow the individuals that I'm a member of the team with to just introduce themselves. We have Luke Crosson. Luke, do you want to say hi really quick? Sorry.
Sure. Can y'all hear me?
We can.
Okay, great. Yeah, hey, Jen. Well, my name is Luke Crosson. As Jenna said, I'm the Calhoun County Ag and Natural Resources agent there and located in Southwest Georgia. And I'm in the office with Shanda Ashley. So I'll turn it over to Shanda. Or back to Jenna.
Hey, Shanda.
Hello, I'm Shanda Ashley. I am, as Luke said, in the Calhoun County office. I am the Calhoun County Extension Coordinator and the 4-H agent.
Hey, Shanda. Cindy?
Hello, my name is Cindy Sheram. I'm the 4-H agent in Washington County, Georgia.
Thanks, Cindy. Allie?
Hey everyone, I'm Allie Berg. I'm an associate professor in nutritional sciences at UGA, and I'm also an extension nutrition and health specialist.
And Courtney?
Hi, everybody. My name is Courtney Brown, and I'm the Community Health Engagement Coordinator for UGA Extension.
Yeah, well, thank you all. And like I said, we would not be here without the profound help and support and leadership and expertise of this group. And I'm Jenna Daniel. I serve as an Extension 4-H specialist. My role is really in grants. And so that's how I got to be a part of this project as it started out as a grant. But just to give you a little bit of a view into what Georgia looks like and to give you some context for the place that we're coming from and the situation we're talking about today. As a state, we have 159 counties that we serve with UGA Extension. And you'll see on this map, that's the districts that we offer as far as how our counties are aligned and outlined within the state. And as a state, we have a population of about 10.9 million. And so when you think of that many communities and that many people, we recognize the diverse needs, and we always operate in a system that allows us not to be prescriptive, but rather to facilitate tools and opportunities for our county faculty and staff to be best able to serve their communities. And so we are fortunate as a system to have between ag and natural resources, family and consumer science, and 4-H, over 300 agents. And so those are individuals throughout the state that are in county offices and in communities where they serve. And you'll just see some of the stats there as far as the groupings and the people and face-to-face contacts and programming we offer as a program. For 4-H specifically, we have over 170,000 youth that are involved, and we have over 10,000 volunteers, and that integrates master gardeners, that talks about teen and adult volunteers with 4-H. And then obviously you'll hear about some of the volunteers that help support community health coalitions as well. We are also fortunate to have 5 residential 4-H facilities, which informs a lot of the work that we do. And you'll see that we offer programming and the facilities themselves to over 90,000 individuals throughout the year. And so I just say that to give us all a little context as we think about communities across the state of Georgia and how we have worked to integrate this kind of framework in the work that we do. And so to give you a little bit of background, this was a grant funding opportunity, and probably many of you in states across the nation have also participated in this funding opportunity. But this was a grant that was funded through National 4-H Council that had support from the Robert Wood Johnson Foundation. And really the goals of what was called Well-Connected Communities was to kind of transform the place through genuine partnership and shared vision. So thinking about place as a community to really transform the needs of that place and space through partnership facilitated by Extension. It also worked to address the determinants of health through policy systems and environmental changes at the local and system level. And Allie and Courtney are going to talk to you a little bit about how that has occurred and how that continues to be a change in our system. And really, as we think about community health coalitions, I think the most unique facet of this opportunity is that it worked to support youth voice and action through partnership with adults. And when I say that, I really truly mean, and you'll hear the stories today, that youth are an integral part of community health, and they were given that same respect and ownership in our community health coalitions. And I think that's what's made it so successful and so impactful in the communities that they've served, is that these youth members served alongside the adults as they thought about and assessed the needs and the data provided to them, as they identified any kind of activity that they were going to do and actions they were going to take, and as they have continued to make that a part of their community. And so just so that you understand a little bit of how this looks, we had 3 counties that participated in well-connected communities. And that was Calhoun County, Washington County, and Colquitt County. And all of those are located in the southern end of our state. They are they're defined as rural in their standing, and so in nature and their geography. But in essentially kind of the guidelines that we were given on a national basis is that each county would have one health coalition, and it was a coalition of partners, of members, of stakeholders, and of youth that was facilitated by Extension faculty and staff. really with the goal of obviously aiming to represent the community that they served. And really what that looked like as far as a logistics or process standpoint is that each coalition was able to review community data, and that could be through county health rankings, through NEEKC data. But as a group, they came together and they looked to see what their community really looked like. And then if that matched up with how they experienced or visualized that, they were able as a group to understand kind of the visualization of their community, to share that with each other, and then to compare, contrast, and combine that, because we all understand with our own unique experiences with perhaps services that we use or that other people use, we may not have the exact same definition of the services or the opportunities in our community, depending on who we are in our community. And so we wanted to make sure that each coalition had representative members of their community, that they had youth voice and youth action within that coalition, and that they worked to serve the needs of their community. And so just so that we have that kind of definition of coalitions, really this is how we operated. And so we define community coalitions as a group of people that represent often organizations or businesses within a community that work together to achieve a common goal. And so for us, the context was health. For others across the nation, this could be different things, but that's really kind of how we operated and where we started. Often these individuals work together to support a larger effort. So again, we're not working to duplicate efforts. We're not trying to duplicate resources, rather trying to identify needs in a community that have not been met, and then really kind of outlining steps that allow us to work to meet those needs. Like I mentioned before, we want them to be representative of the people that they help and they serve. And that is only strengthened by the individuals who are there on the coalition. And just like Extension has been for so long, really this Community Health Coalition initiative was grassroots in nature. And so we, on a state level who were facilitating the grant, we looked to the communities to help decide what they needed, and then we asked how we could support. And so in that way, it was very grassroots in that they communicated back to us what they identified as needs, where they saw that we could support, and they provided the leadership in the counties and communities to model kind of the facilitation of those coalitions. And as I mentioned, youth involvement and leadership was a really interesting and unique component of these community health coalitions. But as research and data shows that youth are becoming increasingly aware and concerned about their health, not only their personal health, but for their community, for individuals and their family, their friends, individuals they interact with on a daily basis. And often, just like anything else, they have great ideas for solutions. And so we use this model of teens as teachers. And so when we think about youth who become members of coalitions, essentially, we want them to have buy-in in what is happening in their community. But as a peer-to-peer model, they then go back and share with their friends, with their individuals that they're on sports teams with, or go to school with, or their parents or grandparents, their guardians. But essentially, because they have so much energy and excitement and enthusiasm for the work that we're doing, we find that that helps spread the great work and the action that comes from these health coalitions. And then also saying just that youth adult partnerships are bidirectional. And so again, it was not youth on a coalition for namesake purpose. It was youth who actually were a part of the team, who had the equal voice and vote on these coalitions, and who provided so many hours of experience and expertise to these groups. We also know that youth have a desire to find their place, and they really are working to identify ways in which they can make a difference. And so for us, a community health coalition was a perfect partnership between youth and adults, because it allowed a facilitated opportunity for youth to be a part of, and then to see the difference that was being made. And so that's just all to really give you a big picture of kind of the context of how University of Georgia is operating within well-connected communities and our health coalitions. But I want you all now to hear a little bit from our experts, and they just introduced themselves as individuals from the county and community. And so you heard Shanda, Ashley, Luke Crosson, and Cindy Sheram. And so I have a few questions that I want to ask them as far as kind of a panel style to see that they can give you some great examples of the work they've been doing and to give you a little more context into this opportunity. And so the first question, and I'll start with Luke, I just want to ask, as you think about well-connected communities and health coalitions, our panel of experts, what areas of need perhaps were identified in some of these very first coalition meetings or gathering sessions?
Okay, thanks, Jenna. So when we first started looking at our health rankings in Calhoun County, we quickly found that our obesity rates were pretty bad as far as the state averages, and so we really decided to really focus in on helping to address our obesity rates. And so one way that we decided to do that was to improve our access to healthy foods and like healthy fresh vegetables. And so we did that through, installing community gardens throughout the county. We also wanted to focus on improving access to like healthy lifestyles, and so we did that through putting in walking trails and improving sidewalks in the county. And as we got with the youth component, we moved into different phases of the project. We started to focus in more on like no smoking initiatives and bullying and things like that that we saw a need for in the county. So I don't want to take all the. Maybe Shanda wants to touch on some of these things. So let me turn it over to Shanda real quick.
You did a great job. Those are wonderful things, and that's what I would have shared, Luke. So thank you.
Okay. Sorry, didn't mean to take everything, Shanda.
All right, Cindy, what did that look like in Washington County for you all?
Well, we discovered that there's definitely an issue when it comes to mental health. Unfortunately, we live in a world where there is a stigma when it comes to problematic situations, with mental health, anxiety, depression, suicidal thoughts, tendencies. And one thing that our group wanted to do definitely was reach out to the young people and help address that stigma and help the young people learn that it's okay, to not be okay. It's okay not to be okay. And one thing that we have done, and we actually did our third one last week, is a mental health youth summit, where we are able to go into the local middle school and we reach all of the 8th grade students. We have collaborated with various people within our community and outside of our community. We have Joan Anderson with Mercer University and our local sheriff's department, Family Connections, and through the partnerships, we're able to reach these students and help them learn how to deal with things like stress, anxiety, depression, anger management, coping skills for negative situations. So we've been able to address that. We have reached close to 600 students. Actually, it may be a few more than 600 students over the past couple of years offering this. It's been very beneficial. We've gotten wonderful feedback through that program. Another issue that we wanted to address was helping the older kids learn about life skills. One thing in schools that you're not taught is how to sew, how to cook, how to, handle a traffic stop. So we were able to partner with local people as well to offer workshops during the school sessions or during the school year last year at our local high school, and teach some of those skills, which was very beneficial. We also have the RSAT program, which is the Residential and Substance Abuse Treatment Program at our local county jail. And the residents or the inmates there They get to learn about different skills like sewing, mindful matters. I know Georgeanne Cook offered that. We've got our ag agent, Rocky Tanner, who has been teaching the guys how to garden. And you see a picture on the bottom of the screen down there with Rocky and some of the RSAT folks and the garden that they created. So we're addressing a lot of issues, a lot of needs within our community, and it's been very beneficial for our community.
Perfect. Thanks, Cindy. I think you all gave a really good kind of overview of the needs, and I'd love to hear, I think Cindy, you talked a little bit about this, but I'd love to hear how you identified the individuals that are on the coalition, and if you could just share some maybe key partnerships that came from that, or organizations or groups that help support this effort. Luke?
Yeah, okay. So, yeah, really just anybody in your community that is going to have buy-in to, whatever your project is focusing on. So, like we have a youth component. So people, local schools, teachers, people, that are administrators at the local school, that was really important for us, to be on our coalition. Public health officials are on our coalition. People from faith-based organizations are on there. Of course, community leaders, mayors, business owners, farmers, law enforcement. Shanda, am I missing anything?
No, and when we brought in the educational component, of course, that's when our youth came in with the educators and actually attend the meetings with their principals or their guidance counselors or their teachers. So it's been a very good program.
Perfect. Thank you all, Cindy.
And we actually just sought out leaders in the school system, as far as youth, youth who have a voice, who want to be heard, who want to make a difference. We identified some of those individuals, as well as individuals within our community. We've got an individual who is actually with the RSAT program, which is actually how we began that offering, through the RSAT program, was by having Corey on our in our group. So, we've had, let's see, Sheriff's Department, we've had somebody from the hospital on there, and additional volunteers. So it's been great to have these partners involved.
Well, thank you all. One of the things that I'd love to know, and I think you've alluded to this a little bit, but what does well-connected communities or community health coalitions look like in your community today? And that could be people, that could be partnerships, or that could be the programming that you're offering. Just give us kind of a big picture of what that looks like in your community.
Well, when I first started off, I mentioned some of our projects that we're working on. We have a network of community gardens throughout the county. So, we have people, gardening throughout the county. And so, people growing fresh fruits and vegetables in those community gardens, but as well as, in their own backyards, that have learned from the project. So that's kind of what it looks like. We have, walking trails that we've created. And so we have people, out and about walking those walking trails that you see as you go about the community. We also, like I said, we've done no smoking initiatives through the project. And so a lot of our public parks now have no smoking signage, where in the past they didn't have that beforehand. And we've promoted a farmer's market there as well now that wasn't there before. And so the community has really changed because of the project. Shanna, you have maybe something else to add?
I'd love to hear about Fruit on the Field. And I also know that you all did some work with around rural health and like mental health with your farmers.
Yes, the Fruit on the Field was a project that the youth actually came up with through a mini grant. And it was they talked to their school systems and wanted to have a healthy alternative to concession stand food. So it started off with a big basket, and each home game got one. And the kids even volunteered in the concession stands. They would hand them out, and it was a huge hit. So the schools have agreed to continue that, not only just on we were started with football, they're going to do it on all their sports events. So it will be an addition. We were doing apples, oranges, bananas, any kind of fresh fruit, but they have adopted it. Now, as far as the mental health for the farmers, I'm going to hand that back to Luke because he handled it in our county.
Yeah, I was part of a pilot project in Georgia for the last several years where as part of our winter production meetings, we do some mental health work with our local farmers just because of there's been a lot of suicide that's been occurring, just in the ag community. And so we've just wanted to focus on our farmers and just let them know that UGA Extension is there as a resource for them, in times of need. And so we're just allocating resources there for them, as far as mental health resources and stuff. And so, like I said, it's just a pilot project, and but we're still continuing to work on that. And there's been some publications and a website that we're working on. But yeah, it's something very important and something that I'm really passionate about, and we really need our farmers. But we've also done some other initiatives. We did a CPR workshop with a group of local farmers and provided them with a lot of first aid kits and some other resources, and we plan to do that again. So that's really beneficial.
Thanks, Luke. Thanks, Shanda. What about you, Cindy?
Well, again, we've just offered a lot of stuff within the school system, so we're really excited about that in the RSAT program. I mentioned the Mental Health Youth Summit a few minutes ago, and I will add that we have a mental health task force for our county as well, and I was in one of the meetings last Friday morning, and Major Trey Burgamy with our Washington County Sheriff's Department actually shared that following the mental health youth summit that we did last Tuesday, Wednesday, he received a phone call that evening from a parent, and the child is dealing with some issues in school and some issues with them as an individual, and some changes and such. And the parent reached out to Trey and let him know that the summit, the class that he actually taught on the suicide and depression and anxiety, struck a chord with that individual, and made them open up and come home and talk to mom and talk about some of the stuff that he was dealing with and some issues. And mom was so impressed that she called Trey to let him know that it made a difference with her child, and that there were some issues going on there that they were not aware of. And now, because of it, the kid was able to come in and talk about it. Without putting too much information there, but it was just very touching for Trey to share that, to know that we are making a difference through these initiatives, through the programs that we're doing.
Okay, thank you all. I appreciate you sharing a little bit more about your programming. I have two questions left just to give you all kind of a baseline, but I think the first question is, can you explain to me how this work differs perhaps from your traditional programming that maybe is siloed in your individual program area, and what some of the benefits or challenges to that are.
Yeah, sure. So, as I said earlier, I'm an ag agent, and so really all we focus on is agriculture and stuff. But this project, has really given me the opportunity to collaborate with all the program areas and really step outside the box and work on a wide range of other topics. And so that's what sets it apart for me. That as well as, being like a youth adult partnership, that really sets it apart as well. But really just being so collaborative and also that, it's not as one dimensional, as our other programming usually is. It addresses physical, mental, social well-being. So yeah, all those factors. Shanda.
I know that I have seen these young people go from doing district project achievement where they stand up in front of a group of their peers and do a speech to taking this information, sharing it with first the community coalitions. Then I've seen them take it to their schools and share it publicly. Then, thanks to Well Connected Community and Robert Wood Johnson Foundation funding and National 4-H Council, they were able to take it even one step further and go and present it on a national level and then an international level. So just to find the fact that they're so proud of the small steps they're taking in their communities that can lead to bigger things, they have not only made me proud, but of the community here as well. And most of them have graduated. We're coming on with a new shift of new ambassadors, but they have left their mark in a positive way.
Thanks, Shanda.
And I really have to second, what Luke and Shanda said, just to see the growth in the young people, especially involved in the program, has been unbelievable. And the collaboration between program areas definitely has been a beneficial thing as well. And I mentioned the growth of young people. I had an individual who was very shy, very kind of standoffish, and didn't really want to talk much. And through this program, through this collaboration, Well Connected Communities, she in turn ran for district office and was elected, and has since graduated. She's served as a camp counselor. I mean, she's in college now doing great, and she's really benefited from the program. So again, just a lot of incredible benefits from this collaboration with program areas and such, and the youth adult partnership, definitely.
Okay, thank you all. So the last question that I wanted to ask is really about kind of some of the byproducts of this work. So what are some of the impacts, the outcomes, the changes that you have seen both within the coalition, but your community at large, that are kind of directly linked to this work in your health coalitions?
So as far as the impacts,
Yeah.
well, I mean, we're definitely seeing a lot more people being able to grow their own fresh foods and vegetables. I get a lot more questions, throughout the community, as far as people starting their own gardens in their backyards and stuff. And so, um, um, and even checking I don't know if the project has contributed to this, but the last time I went and checked the state health rankings, some of our metrics have improved over the last couple of years. So maybe the project has actually improved some of our rankings. I'm not sure, but some of them have actually gotten better. And so and some of our other projects that we really haven't touched on, but I don't know, just overall there's been a lot of impact. I don't know. I think I'll let Shanda take. I've done a lot of the talking. I'll let Shanda talk about the impact. She does better with this than I do.
Thank you, Luke. Again, I think that first of all, the youth voice is being heard within the community and our community members here, and I'm sure it's been the same with Cindy and in Washington County. The adults welcomed their input. They respected them. There was a mutual respect. They worked together in their work groups, and the young people came up with ideas, and so did the adults, and they just worked together seamlessly. It's just been positive I've seen it in the schools, the difference in the young people wanting to be a part of what these kids have been doing. So it has grown, and we do get calls. I have to go to the school and meet with young people that want to take the place of an ambassador that has graduated and be part of the many things going on. And they'll volunteer when we do things in our garden and when we do things at the school. Luke and I team teach with some ag information, and they have gardens there. So we have the young people, they volunteer and they want to be a part of it. So it's just been wonderful to see them grow and for it to catch on with others.
Hello, this is Dale, and part of my role today, I'm on the Professional Development Committee, is to help monitor some discussions in the chat. So if one of the presenters at least would like to look at a side conversation about safe routes to schools, there's some good conversation around that topic, and maybe you can help address those.
Yeah, Jenna, if I may, I can take that one as I've been sort of engaging in that chat on the side. So our friend here on this call today asked about if we had participated in safe routes to schools combined with biking and walking buses as a way to increase activities. So if you guys aren't familiar, Safe Routes to Schools is an initiative and it takes a lot of different forms, but it's basically the idea that if we can get kids to walk or bike to school and do it maybe together in a safe way, that's a way to increase activity, that more kids are getting dropped off at school these days. And my response was that, especially in the communities that you're talking to today, the challenge here was really just geographic spread. Basically, the route to school can be several miles long that for some of our kiddos just really isn't feasible to do on a bike or in walking. So in these communities specifically, there were some efforts made to address the places where people can bike and walk and trying to improve crosswalks or activity-friendly routes from common destinations like the grocery store to the city center. And not always is the school necessarily on that route. But I can't see Guillermo on my vision here today, but I like the idea. He shared back with me that in part of the tribal communities in Minnesota, they use it a few times a year to just get kids excited about walking to school. So I never really thought about that as like an event, more so to kind of gain excitement around this as a potential strategy. So I thank you for that tip, and I'd be happy to talk any more about those different strategies.
Perfect. Well, Cindy, will you round out this panel portion just kind of with some impact you've seen in your community? And then we're going to turn it over to Allie and Courtney as they talk about how, as an extension organization, we're focusing on the future with these initiatives.
Absolutely. I think I've already hit on a lot of our impact that we've had in our community through our program. I definitely, I will say just in general, overall, the adult youth partnership has been very impactful. Shanda mentioned it a few minutes ago that the youth feel like they have a voice and the adults listen. And that has definitely been impactful because through some of these programs we've offered, we've had our young people share their thoughts, their ideas, what they envision for our community based on needs assessments that have been done. And the adults listen, and the kids have ownership in it, and it definitely it helps tremendously.
Perfect. Well, thank you for wrapping us up so well there and giving a bow to that conversation. Thank you all for participating. And again, like I mentioned, these are our county faculty and staff who have been working on the ground in these health coalition efforts. And they really have been the change, the leadership, the expertise of their communities, and have shared back with us on a state level how that works, what the challenges are, how we can better integrate this into a systematic approach so that other communities and counties can integrate this into their work. And so I'm so excited that Dr. Allie Berg and Dr. Courtney Brown, who you heard from earlier, they're just going to kind of wrap us up and take us and tell us a little bit about how Extension is working to integrate this in Georgia into their system. So Allie and Courtney.
Thank you, Jenna. And thank you to Luke and Shanda and Cindy for explaining so well kind of how this project looked in their different counties. I'm going to share just a little bit about how we're trying to take some of the things that we learned and experienced through well-connected communities and bring it a little bit more into our regular practice and extension. So we've had this project, Well Connected Communities, and a similar project that I'm sure some folks on the call have been involved in called HOP. And they both really prioritized community-driven change through community coalitions and policy systems and environment change. So when we started these projects, we didn't have a lot of formal training in extension around community health coalitions. Very little, if any, and most of it maybe was focused around the advisory teams that guide our agents at the county level. But we didn't really have a lot about collaborative community coalitions and how those are led. And we still don't have a ton, but we have some. So we're working really hard to strengthen the community coalition and PSC training that we offer at our extension system level. We now have a Community Coalition 101 training that has been offered 2 years in a row, and that training is offered as part of our Family and Consumer Sciences Foundations training. So new Family and Consumer Sciences agents are getting that. Every year I'm teaching that in their foundations training, and then it has also been open for other program areas during our regular extension training system trainings. We also have some introduction to policy systems and environmental change training that's been made part of our Family Consumer Sciences training for new agents. So we're planning to continue that. In fact, in January, we're offering sort of a coalition troubleshooting training, and Luke and Shanda and Cindy, you'll probably have me knocking at your door via email to come share at that training as well, because we love learning from y'all's experiences. So we're continuing to build on these community coalition trainings, and we hope to keep offering more in the future, so that our agents don't have to learn everything on the job. They're great at doing that, and Luke and Shanda and Cindy certainly have, but we want to be able to offer more training to our agents across the board, and not just in the Family Consumer Sciences where we think about health a lot, but in our other program areas too. I mean, y'all probably noticed today that you heard from 2 4-H agents and 1 ag agent. So we didn't even have our Family Consumer Sciences agents represented today because this project has been so integrated across program areas. We've also got some short publications that we're working on. These will be for both community members and for our agents that cover things like an introduction to policy systems and environmental change, some community coalition basics, things that they can use to be co-leaders in their community. We're also working on some new ways to think about needs assessment and making sure that we're hearing that community voice. So you probably heard through the panel today that they did look at data before they decided what their projects were going to be. And a lot of that is secondary data that we're looking at, the available public health statistics in our communities. But we also want to get better information from our community members themselves. So we're developing some new ways to collect information about community needs. Allie and I in particular are working on a pilot project where we're exploring some different methods of how to collect that information from community members. We're also in our Family Consumer Sciences program area doing a little bit of a revamping of our needs assessment process so that we can maybe respond more quickly when kind of timely issues arrive. For example, the hurricane, some recent hurricanes really affected our area, and we know that our agents have to sort of shift what they're doing to address that, and that impacts what communities are doing that may not be reflected in that publicly available data that we're sourcing. So we're trying to compare this community need data that we're getting from coalitions and from community members and comparing it with other available and appropriate metrics so that we can make better data-driven decisions. One other kind of data point that we're working on is something that we're calling our community mindset work. We really have struggled with how to appropriately assess impact of projects like this, where you're not necessarily going to move the needle on a relevant health statistic super quickly. So, for example, Luke and Shanda have been working on addressing nutrition and physical activity in Calhoun County for a very long time. And we may be starting to see some change in the obesity rates that Luke mentioned, but realistically, it's very hard to change that in, under 10 years. So what are some other things we can look at that would indicate that our work is having some kind of effect? And one of those is in the mindset of the community. So when a community starts working, do they think that change is possible? Are they ready for change? Are there some members of the community that are invested and others that aren't? I know you've heard the word buy-in in this presentation before, and that is really an essential ingredient to getting any kind of community-driven work done. So how do we assess buy-in? And part of that we're looking at is this community coalition mindset. So we've used a process called quantitative empathy to kind of assess what is the mindset of different community coalition members? How do these different mindsets work together? And what mix of mindsets do we need to have in the room to move things forward? So that's one kind of method that's sort of in its infancy that we're using of trying to figure out how we're going to push this work forward to identify what happens before the impact in those health statistics comes. Allie, I'm going to turn it over to you if you want to add anything before I talk just a little bit about our work with CTSA.
Yeah, no, Courtney, I think you did a great job of sort of summarizing our work. I think through this process, we've always known that Extension across the nation is a very grassroots organization. We've always worked from ground up to assess and address community need. But I think this project helped us shine our strengths shine and see where we do connect, but also helped us identify some places where we could improve these processes to better reflect our work and make sure that we are true to those community needs. I know one thing that I personally will take forward as far as a facts extension specialist is really trying to involve youth in those coalitions where possible. When you get a bunch of adults who have a lot of competing priorities in a room together to talk about things, we can be kind of negative about what's not possible. But our youth really provide that, inspired and passionate voice. And often they'll bring out things that maybe we didn't realize were, such an important issue. So I think this community voice data that Courtney was talking about as part of our needs assessment process, if you look at your county data from a public health perspective or what's out there published, you may not feel like that's really reflective of your community. And so some of these other ways in which we're assessing needs and documenting impacts, we hope we'll be able to tell the true story of these communities. So yeah, I think other than that, Courtney, you did a great job. If you'll take us to the CTSA part.
All right. So yeah, the last thing I was going to mention about kind of where we're going in the future and where this work is going, Allie and I work with a group called the Georgia Clinical and Translational Science Alliance. And it may sound surprising at first to hear Extension aligned with something that sounds so very medical. But what we're helping them to do is make sure that translational research and science, which basically just means getting medical advancements into people's lives faster, that they are thinking of the community when they're doing their work, that they're thinking about rural areas and that they're getting those people involved in what they do so that the future of medicine is shaped by all of the people that need it, not just people in cities or not just, one type of person and not just the people that are easily available to participate in clinical research. So to that end, we are trying to connect researchers with communities that have shared interest. So that's kind of, again, where this community coalition piece comes in. We want to be able to connect researchers with communities that have coalitions that have already decided we're interested in this topic so that the research needs match the community. Communities can get access to the experts they need that have information and evidence-based, information to share with their communities so that we can have, these cutting edge advances happening all across our state. So we're using this community voice data and hoping to continue to encourage coalition work across extension so that we can match up our communities with the experts that they need. Because while we have a lot of great extension specialists, we know that we can't cover every single health topic. There's just too many. So that's kind of the last piece for our future direction. So overall, we're working on strengthening those community coalitions and the way that we support them at the state level. We're trying to strengthen the way that we do needs assessment and gather more community voice data so that we have that to guide what we're doing in extension. And then we're making new connections and partnerships with partners like the Georgia CTSA so that we can do a better job of serving our state and improving health in Georgia.
Okay. Well, thank you, Courtney and Allie, for rounding that out for us. I know that we are getting close to time, and so I just wanted to offer a moment if anybody has any questions who's on our live Zoom, if you'd like to pop them in the chat or hop on and ask them, we'd love to answer them. But regardless, we appreciate your engagement and involvement in our conversation today. And we hope that it has been helpful. We wanted to provide a little bit of contact information just in case you had further questions. We'd love to engage in that conversation. So.
Thanks, Jenna. Are there any questions that people like to ask? There's a quiet group. One term towards the end there that I've never heard of before is quantitative empathy. So that was something new that I learned. Can you explain a little more of that?
Oh, I wish that I had our colleague that is leading that effort on today. So that work is really at the very beginning. So what we've done so far is we've done basically some surveys with our community coalition members that Shanda, Luke, and Cindy have been leading. And we've also done a kind of a larger survey with a larger sample to look at that data. And from that, Dr. Dee Wormuth is the one leading this effort. And Allie, feel free to jump in if you feel like you could explain some of these pieces better. But basically, from the results of that survey, it's sort of like a survey that I don't want to call it a personality test because that's not what it is, but the questions are similar to the type of questions that you might see when you take something like a Myers-Briggs test or something like that. Questions that assess kind of their interest in health, the way that they feel about working in their community, doing that kind of service work that community coalition work is, essentially their attitudes towards it, how they feel about it, how important health is to them. So it's a series of questions like that. And from that, we were basically able to identify 7 different groups where their answers were clustering together through a process called factor analysis. And those 7 groups, I don't have time to tell you what all of them were, but basically there's some different groups that lets us know who we have in our coalition. So one group that is easy to talk about is a group emerged called the dedicated doers. And these are your people that are going to get the work done. So the people in your coalition that might not be piping up with the bright, super shiny new ideas, but you know that when you send out a call to say, we need help doing this, they're going to be the ones that show up and get it done. And you need to have a certain number of those on your coalition for anything to get done, because not everybody can be, I forget the name, the cute name that Dr. Wormuth came up for the top group that does like a lot of the leading, but not everybody can be the big loud leader in the coalition. So you need to have a mix of the different groups. And then we had one group of people that kind of emerged that was sort of basically reluctant. They were reluctant to engage. And we don't yet know exactly how we move people from one group to another. So far, we've identified these different groups, but we're curious if over the course of spending time in a coalition, do people move from one group to another? Does a dedicated doer over time become one of these more vocal leaders because of their experience in the coalition? Or to have change, do we need people to move from a certain place of maybe not being as engaged engaged to being more engaged in order to have some kind of impact in the community. Allie, did I capture that? You want to add anything?
No, I think you did a great job, Courtney. It's a complex process. But yeah, I think everybody on this call has probably figured that at some point that it is hard to measure the impact of work in prevention or work in youth development sometimes. And so we're exploring this as a way to help us do that. And also to figure out, if you're starting a new coalition, what are those roles that you need on the coalition to really get things moving? We can't have a whole bunch of leaders that talk too much or you'll never get anything done, right?
I see now that Jenna very helpfully dropped some language from our recent poster in the chat, Allie. So people now can see all the different 7 groups that we found.
Yeah, I think you did a great job, Courtney. Without our resident expert here, you did an awesome job of making it tangible.
Yes, thank you. And I see that we had another question in the chat regarding this as well. I think you may have answered it, but I just want to make sure, how are you implementing the community mindset shift using the qualitative empathy?
Yes, I think that's our best effort to explain that. We're not quite implementing anything related to the shift yet. So far, we've just defined those characteristics.
Great, thanks. Yep, Katie agrees. It's always good. Any other questions? Well, not hearing or seeing any others. So then I'd just like to thank Jenna, Courtney, Shanda, Luke, and Cindy for sharing with us today on Community Health Coalitions. We really appreciate everyone else attending the webinar. We had a great turnout. As I mentioned in the beginning, we did record this, and with this will be shared after today's session. Our next webinar is January 13th, and it'll be on the topic of Extension Agent Retention Research Study, practices that improve job satisfaction and agent longevity. And lastly, I just want to remember everybody to renew their ESP memberships as soon as you can, and have a great holiday season and a happy new year to everyone. So thank you for your time today.